I find it very, very exciting that I can start applying that knowledge to already some of the clients that I'm seeing. And it didn't come across as too academic. It's a simplified information that we can apply to our clients. Regarding incontinences, for example, like I only knew there were two types of incontinences that I was practicing on, but now that it's more simplified, I know that there are 4 to 5 types of incontinences and how to treat them in different ways than just doing Kegels all the time. It just gives us a lot of functional tool to differentiate where the symptoms could be coming from and how we can address that. So I think those, especially who are stuck in a rut as to why they're not improving, and if they've had symptoms for a long time, they've been to multiple clinicians, I think with the information that we are given, we can certainly pinpoint what could be the reason and address it, rather than having patient go through complications or circles of clinicians where they don't know where it's coming from. I have gone through a couple of online courses that does talk about prostate cancer and cancer rehab, and I think this one was particularly a lot more informative because it's informed. So Woody not only goes through what they do in prostatectomy, but he also goes through what are the stages of cancer and how it impacts the sphincter and how the surgeries would impact the removal of cancer and how that would impact the structures around prostate. So no, I think it was a lot more detailed. Yes, absolutely. Because if a client is coming to me and with a diagnosis that I've had, say stage 4 prostate cancer, I now know exactly what that client would have had and what kind of surgery impact would have had versus stage 1 or stage 2 cancer. So no, that definitely makes a big difference in just perceiving client right from the history that what clients structural changes would have gone through because of the stage 4. As we know, this is a male course, and so it was very helpful to learn and to palpate in a live client or live model rather, to understand exactly where prostate is, to understand where pelvic floor function comes into picture, and to actually experience it while palpating rectally was quite helpful. I also really liked the ultrasound part because it gave the insight right then and there as the bladder full, not full, is the client contracting pelvic floor correctly or not. So yes, I definitely did learn exactly how to do rectal examination for clients, starting in stages of how to do I think it was a lot more than I knew already. In sense that every time I've taken a course, there hasn't been much of a male focus in the course. It's mostly women focused, which is why I wanted to take up a course that talks about a lot of male urinary function. So the course not only covered anatomy, but it also covered extremely important but basic examination. Like I wouldn't know how to do, I wouldn't have checked, for example, testicular movements in my client up until now. Until I took this course, I would start taking active, passive, and resistance testicular movements when needed. Yeah, I think it will give us a lot more idea into rather than just focusing on digital exam and how they're palpating or how they're contracting their pelvic floor. So this all other details give us a much broader view to look at clients' case and therefore help us differentiate with clinical reasoning.